The sun can damage our skin year-round. Many people don't worry about skin cancer until the warm weather sunbathing months. And that's why skin cancer screenings are held this time of year. Dr. Max Gomez is here to tell us about your chance to get checked out.
That's right, and not just checked out for free. In a minute, I'm going to tell you where to call for these free screenings, so get a pencil and paper. Now, the reason you should pay attention is that skin cancer is at epidemic levels, especially the deadly malignant melanoma. In 1996 alone, melanoma went up 6%, and deaths from the cancer went up 2% just in 1 year. And in case you think screenings are a waste of time, nearly 10% of the people screened last year turned out to have skin cancer. Kaylin Moran Healy has the coloring typical of an Irish lass, fair skin and blue eyes. Very attractive, but it has a downside.
I had a spot on my face that looked like a pimple. It came back that it was cancerous.
Disturbingly, Kaylin is only 29 years old, yet she probably had the skin cancer since she was 25. Dermatologists say it's a frightening trend they're seeing way too much of.
That's really the terrible thing. We are seeing skin cancer at a much earlier age than we did years ago. We see patients in our practice who now are developing skin cancer in their early 20s.
Doctors say we're paying the price now for all the years past we spent in the sun without sunscreens. And the early incidence of skin cancer is due to the estimate that we get 80% of our lifetime sun damage by the time we're 18. But there is good news.
The great thing about skin cancer, if there is a great thing, is that if you detect it early, it's completely curable. And melanoma in particular can be deadly if it's not detected early enough. So if you go out and have your skin checked, and even if something may be changing and it's very early on, in most cases it's completely curable.
Trouble is, a lot of people think that skin cancers are easy to spot. They're big, nasty-looking moles with lots of colors. But in fact, skin cancer can be very subtle, and that's why you need a dermatologist who's trained at identifying suspicious spots. In fact, while we were taping Kaylin today, Dr. Katz found 2 more likely skin cancers that could easily pass for tiny pimples. That's why she has this advice.
Wear sunscreen all the time, and to be careful and to become aware of any spots that you have on your body and have them checked out, and don't take anything for granted.
Now, the free screenings are going to be held this weekend at 16 New York area hospitals. To find the hospital nearest you and the times for their screenings, call the screening hotline at 212-237-3900, 212-237-3900. Remember, skin cancer can hit anyone, including African Americans, but it is among the most curable of all cancers if caught early, and that's why the screening is important. And besides, when you get a chance at free medical care.